here is your question. Right, so if you have read and understood considering its surgical pathology station, kindly tell me what is carcinoid tumor?
So carcinoid tumor is a malignant tumor of the enterochromaffin cell.
Okay. This patient has undergone pneumonectomy and got the diagnosis of small cell lung carcinoma. How would you classify lung carcinomas?
So lung carcinoma can be classified as small cell lung cancer and non-small cell. So non-small cell is adenocarcinoma, squamous cell carcinoma, and large cell carcinoma.
Okay. So what is the prognosis of getting the diagnosis of small cell lung carcinoma?
Okay, so small cell lung carcinoma has the worst prognosis.
What are the risk factors which causes small cell lung carcinoma?
So it can be family history, it can be genetics, smoking, then working in a mine, then maybe working in a petroleum company.
Yes, occupational hazard.
Yeah.
Okay. Can you tell me what should be the treatment or what advice would you give to the patient after reading this stem?
Okay, so this one has they found a carcinoid tumor invading the pleura and lymph nodes. So it's already T4 and NX and M1.
Okay.
So for this one is mainly for palliative care.
Okay.
So we can
Would the
explain the
chemotherapy and
patient.
radiotherapy
Yes, we can explain the
any?
patient that
Yes.
there is no surgical option left for the patient. We can give palliative chemotherapy and radiation therapy.
Okay. So the answer would be that after discussing with the MDT team, you'll suggest this that
Okay.
you're telling me now. Good. Okay. Can you tell me how would you differentiate between bronchogenic carcinoma and mesothelioma?
Okay, so mesothelioma is a malignancy from the pleura, and
Okay.
the bronchogenic carcinoma is from the lungs, parenchyma. So mesothelioma is mostly from the peripheral part, and bronchogenic carcinoma is from the central region. And the prognosis is worse in case of bronchogenic carcinoma, and mesothelioma is better than bronchogenic carcinoma.
What about the mode of spread? How does it spread? Which of both? Compare them and tell me, please.
Okay, so bronchogenic carcinoma, I think mainly hematogenous spread, and mesothelioma maybe local spread.
Okay. Right. You told me that there is involvement of, okay, pleural plaques. What's the significance?
So pleural plaques is a well-capsulated lesion in the pleura. So is significant. Mostly is due to asbestos exposure,
Okay.
and it carries a high risk of malignancy.
Good. But it's mostly benign, cancerous, non-carcinogenous.
Okay.
So, all right, if you can tell me, what is adenocarcinoma?
So adenocarcinoma is a carcinoma of the epithelial cell with a
Yes.
glandular pattern.
And
with glandular proliferation.
yes, and it's most common in non-smokers. Which tumor markers are associated with adenocarcinoma of the lung?
Tumor marker. Okay, I will come back later for this question.
Okay. Tumor necrosis factor 1. Okay.
Okay.
All right. Right. If you can tell me the pathology or pathogenesis of the pleura, which happens or which takes place here in carcinoid tumor invading the pleura. So if you can tell me the pathogenesis, how the disease process takes place.
Okay. So carcinoid is mainly arising from the appendix or maybe small bowel or pancreas or other things. So it will.
Only when
It
it
will.
invades pleura, please.
Okay. So it's mainly spread in the liver first and the lungs. So
In the lungs, it causes isolated thickening of the pleura, and then it causes the calcifications, especially when it is exposed to occupational hazards like asbestos, etc. So then only the malignancy risk increases. All right. Can you tell me right. What investigations more can you do to confirm or which can help you for the
So
management?
for investigation of carcinoid, we can
After
do
what you have done already. So what more would you do?
Okay. So we can do immunohistochemistry and we can do some blood test.
Good, like?
We can do chromogenin A, and immunohistochemistry will confirm chromogenin B, and then we can check urine for 5 here, 24 hours 5 here. Then we can do CT scan or PET CET for proper staging and grading.
Okay.
For chest CT, abdominal CT, and pelvic CT, and PET CT.
Right. What more I can ask you? You can tell me about the tumor markers which are associated with lung carcinoma, or maybe we can come back to those later.
Yes.
Okay. Yeah, that was okay. If the same patient comes to you and you see that patient has metastasis, and right, you right, I can't. So this lung carcinoma, what is the most common site of spread?
Lung carcinoma, it can be bone, I think. Liver and bone.
Okay. What about the lungs, the lymph nodes?
Yes, lymph nodes is also there.
Yeah. All right. Right. Okay. A few seconds are left, and then we can discuss. Right. Thank you.